I'm Dr. Frita, and today I'm giving you 7 silent heart attack warning signs and symptoms that women often dismiss as stress. And number 5 contains no chest pain. If you have been having symptoms and you keep telling yourself that it's probably just stress, I want you to stay with me because heart disease is the number 1 cause of death among women in the United States. According to the American Heart Association, heart disease claims more lives than all cancers combined. So this is really serious. And this is what's interesting. Most of what the public knows about heart disease is based on research studies done in men. So when you see that classic example of a man grabbing his chest and slumping over with a heart attack, many times women don't even present that way. Oftentimes with women, the symptoms are silent and scattered, which makes it much easier to rationalize them away. This gap in public knowledge is likely what makes it so easy for women to oftentimes wait so long before seeking medical help. So if you're someone who's been having symptoms that you think could be related to heart disease, I don't want you to just tell yourself that you're being overdramatic or that you're being hysterical. No, I want you to stay and listen to me because today I'm giving you 7 silent heart attack warning signs and symptoms that many women dismiss as stress. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. I'm Dr. Frita. I'm an MD, a medical doctor who has been quadruple board certified. And I want you to go ahead and give this video a like and a share because I'm about to give you some evidence-based medical information. Let's go ahead and dive into the 7 silent warning signs and symptoms of a heart attack that women oftentimes don't recognize. Number 1, unusual fatigue that won't go away. And I'm not just talking about run-of-the-mill being tired. I mean the kind of fatigue that makes you wake up tired even if you have had a good night's sleep. This is the kind of fatigue that makes simple tasks use twice as much energy, and oftentimes there's no clear explanation. Here's what's happening in your body. When the heart muscle is not getting enough perfusion, the proper blood flow due to blockage perhaps, or if it's not pumping efficiently enough, then the body rations energy out in other ways, making your entire body feel fatigued. According to studies published in the journal Circulation, unusual fatigue is one of the most common symptoms reported by women weeks leading up to a heart attack. In fact, some women report this unusual fatigue occurring as much as a month before the heart attack. This time window is important because it means that in some cases, women's bodies give them a nice warning before the actual catastrophic event of a heart attack happens. So why would women ignore unusual fatigue? Well, because oftentimes in society, we've been conditioned to push through the fatigue, push through the tiredness, be strong women, be super women, right? We're used to, having to balance being tired with all of the different tasks of being a wife, a mother, a business owner. We tell ourselves that we have to be strong and that we can't really worry about being a little bit sleepy. But truth of the matter, unusual fatigue really can be one of those silent warning symptoms that you could be having a heart attack. So if you are experiencing unusual fatigue, I mean fatigue that doesn't have a clear explanation and that is around even with a good night's sleep, if it comes on suddenly or if it lasts for days without getting better, even if you had good sleep, I want you to contact your doctor right away. Number 2, shortness of breath during simple activities. Now, this is one that is very often ignored by women. And honestly, this symptom really could be a warning that you're having a heart attack. So just picture this. What happens if you take a walk up one flight of stairs, or if you're taking groceries in the house from the car, or if you're just having a phone conversation? Is it leaving you short of breath? And the real question is, has there been a shift? Are you now getting tired by doing these activities if you're getting short of breath now and you weren't before? Is that happening? If so, pay attention because it really could be a warning symptom of heart disease. Here's what happens. If the heart is not pumping efficiently, for example, if you have cardiomyopathy or congestive heart failure, then doing simple activities could lead to shortness of breath because you're just not moving blood forward in your body the way that you used to, and you might even be getting some fluid built up in the lungs. As far as a heart attack warning, well, if you have damaged blood vessels or blocked blood vessels and the heart muscle is not getting the blood flow that it should, then yes, simple activities will make you short of breath. A lot of women will say, oh, I'm short of breath because I have anxiety, or maybe I'm having a panic attack, or maybe I'm just stressed out. And yes, anxiety really can cause you to hyperventilate or have shortness of breath. But I want you to be careful not to dismiss the shortness of breath if it is not clear. Pay attention to yourself. If this shortness of breath is now happening more frequently, if it's happening even more with activity, if sometimes the shortness of breath is even coming on while you're at rest, talk to your doctor. Also, a lot of women say, oh, I'm just out of shape. Oh, I'm just getting older and I'm out of shape. And that's why I'm having shortness of breath. Sure, deconditioning can cause shortness of breath, but so can heart attacks. So if you're having a change or a shift in shortness of breath, if activities that you used to be able to tolerate are now causing you to be winded, then contact your doctor right away. Number 3, nausea, indigestion, or stomach discomfort. Now, this one really is scary because you can see why women would just kind of dismiss this one. It presents just like heartburn or GERD. But honestly, many women will have this be the only presentation of a warning to a heart attack. Here's what happens. The vagus nerve runs through the digestive system. And when the heart is not getting sufficient blood flow, it can irritate this nerve and cause you to have symptoms of indigestion or stomach discomfort. And many times you can't really distinguish it from heartburn. So women will go into the ER and they'll be told that they're just having GERD, gastroesophageal reflux disease. But here's the key. They'll be given the antacids. They'll be given, medicines like for anti-stomach acid, and they'll still have the pain. Same thing at home. If you're having this indigestion, and it will present sometimes as nausea, as epigastric pain, meaning a little bit of pain right under the central rib cage, right above the abdomen. If you're having that, and even though you're taking all of your antacids at home, it's still not getting better, you really want to be careful because yes, it could be heart disease. In addition to women, diabetics often present this way also with nausea or stomach pain, and it could be a heart attack. So here's what you do. If you're experiencing this indigestion, if it's not getting better with antacids, if it's not going away, if you see that it's getting worse when you do certain activities and exert yourself, and certainly if it's paired with other symptoms like back pain, arm pain, shortness of breath, then contact your doctor. And don't just tell your doctor you're having some stomach pain. Specifically ask if your doctor will evaluate you for heart disease. Question: have you ever experienced one of these symptoms and you told yourself that it was just stress? Please tell me about it in the comments below. I read them. Number 4, pain or pressure in the upper back. Not all back pain is caused by muscles or strain. Back pain is actually one of the most easily missed warning signs. The American Heart Association has documented that women present with upper back pain as a symptom of heart attack significantly more frequently than men. Here's how it presents. When a woman has back pain that is due to a heart attack, it typically presents in the upper back, so up between the shoulder blades. It does not typically present in the lower back where we normally think of back pain. And the quality of the pain is a bit different. It's typically a squeezing or pressure, okay, as opposed to just a sharp localized muscle pain. The other thing about back pain when it's associated with heart disease is that it can radiate. It can sometimes radiate to the neck or to the arms. When women have upper back pain, we can come up with so many excuses. We can say maybe we just slept wrong, or maybe we need a new mattress. Maybe we were carrying a bag that was too heavy, or perhaps we did a new activity. And yes, all of these things really can cause back pain. But here's the key. When the back pain is related to heart disease, when you do things like stretching or heat or muscle relaxers, things that normally will reduce musculoskeletal pain or run-of-the-mill back pain, they don't work with heart attack related back pain. Also, heart attack related back pain might be accompanied again by radiation of the pain, or it might be accompanied with shortness of breath, or it might be accompanied with chest pain, or it might be accompanied with indigestion. Okay. The linking of the symptoms can sometimes be very important. So, if you are a woman and you are experiencing pain in the upper back that's causing you to have a pressure and it just doesn't seem typical, make sure you consult with your doctor. And again, specifically ask to be evaluated for heart disease. Number 5, lightheadedness and sudden dizziness. No chest pain. Do you hear me? No chest pain. One of the biggest pieces of misunderstanding when it comes to heart attacks is that you have to have chest pain. You don't, especially in women. We often present with a sudden dizziness or a lightheadedness. And I'm not talking about a typical lightheadedness, one that is gradual or that you get just if you stand up too fast. I'm talking about a sudden, debilitating dizziness, feeling like you're about to black out. It can be with a lightheadedness, with the room spinning. It can be with the room kind of going in waves. And it, again, comes on suddenly most often. And here's the sad part. A lot of times women will dismiss it because it can go away within a matter of seconds, but it still can mean that you're having heart disease. Here's what's happening in your body. If your heart muscle is not getting enough blood flow, if there's blockage, and then if the heart muscle is not able to pump enough blood to the brain, this can cause you to have that sudden dizziness, okay? It literally can be a warning that you're having a heart attack. A lot of women will come up with a bunch of reasons or excuses and say, oh, maybe I'm just stressed. Maybe I'm dehydrated. Maybe I have low blood sugar. Maybe I have anxiety. And yes, all of these things can cause you to be lightheaded or dizzy. But what you don't want to do is miss a warning of a heart attack. So, if you're experiencing dizziness, lightheadedness, especially if you have no clear explanation, then consult with your doctor and ask specifically to be evaluated for heart disease. It could save your life. Question: what topic do you want me to go deeper on next? This community helps shape what I cover, so let me know. Number 6, jaw pain or neck discomfort. This is one that is very easily overlooked. And I find that a lot of my patients never heard of having just jaw pain or neck pain as an actual warning that they could be having a heart attack. Because here's the thing, the jaw pain and neck pain can occur alongside chest pain, but it can also occur with no chest pain. And normally women will think that it's something related to a dental problem. And that makes sense. They might dismiss it as being a TMJ, or maybe that they have a cavity. Maybe they've had some teeth grinding and that's what's causing the issue. But actually, it really can be due to a heart attack. Here's what's happening in your body. Your heart shares nerve pathways with the jaw, with the neck, which is why when you're actually having a heart attack or you're having insufficient blood flow to your heart muscle, it can show up in the jaw and or the neck. This is called referred pain. And the pain that's associated with heart disease in the jaw or the neck is typically a pressure pain or a tightness, and it can come and go. Here's a scenario that can happen. If a woman is having this jaw pain or this neck pain, and she kind of goes through and decides all the things that it can be, if her chest is not hurting, then certainly that's not going to be on the top of the list. But the woman might go to see her dentist. That's logical. The dentist might go through all of the exams, then the x-rays, and find absolutely nothing. The woman goes home and later has a heart attack. This is a very plausible reality. And so, If you are a woman listening to the sound of my voice, or anyone, quite frankly, if you're having jaw or neck pain, please don't just automatically dismiss it as being dental, especially if the dentist has already ruled out the possible diagnoses. I want you to at least consider the possibility that it could be a heart-related pain, especially if it's paired with something else like back pain, shortness of breath. Call your doctor and ask specifically, could my jaw or neck pain be heart related? Make sure that you bring it up, that you advocate for yourself so that you don't miss a possible silent warning symptom of a heart attack. Number 7, cold sweats that come out of nowhere. I'm talking about you're doing fine, you're not warm, and then all of a sudden you break out into a cold sweat. Yes, believe it or not, women, this could be a warning symptom of a heart attack. Here's what happens. When the heart is under stress, then it triggers the nervous system to go into somewhat of a panic mode, a stress response, and that can show up as a cold sweat or diaphoresis. Here's the issue. Other things that happen to women can cause cold sweats that come out of nowhere, such as hot flashes. Also, if you have anxiety, stress, if you happen to be in a warm room, yes, all of these things can also cause you to break out into a cold sweat. Here's the key. If this cold sweat occurs with even one of the other symptoms that I've mentioned on today's list, then you must consider heart disease. So if you're breaking out into a cold sweat and you also have upper back pain, or you also have some jaw pain, or you also have shortness of breath, then I want you to stop and call 911, because this diaphoresis, especially when associated with other possible warning signs and symptoms of heart attacks, can literally be the warning that your heart is under distress. And yes, hot flashes and perimenopausal symptoms can certainly result in these kind of similar cold sweats that come out of nowhere. But instead of just reaching for a hormone patch or saying, oh, I'm just going through the change, which yes, it could be possible, make sure that you don't sit there and miss a heart attack. Which sign or symptom on this list surprised you the most? Please drop it in the comments down below. Okay, women, it's time for action. Now you know the silent heart attack symptoms that many women dismiss as stress. Let's talk about what to do about it, the action steps. If you are experiencing these symptoms, call 911. Do not try to drive yourself to the hospital, because guess what? Time is tissue. If you call 911 and you have the emergency medical staff at your house, treatment starts right away, even before you get to the hospital. Also, imagine if you're having a heart attack and you drive, but then you lose consciousness or you're in so much pain you can't drive. Now, not only have you put your life in jeopardy, but you've put everyone on the highway's life in jeopardy as well. Call 911. Here's the other thing. If you do not have an allergy to aspirin or some type of a reason you can't take it, a contraindication, then it is a standard recommendation that if you suspect that you're having a heart attack, you should chew one 325 milligram tablet of aspirin or chew 4 low dose 81 milligram tablets of aspirin. Chewing it allows it to get into your stream faster and to help prevent platelets from clotting and to help to slow down the negative effects of a heart attack. Make sure you consult with your doctor about this one. Consult with your doctor on whether or not you're someone who is recommended to chew aspirin if you suspect that you're having a heart attack. The other thing is, don't minimize your symptoms. It has been well documented that women are often under triage. In other words, the suspicion of women having heart attacks when they actually are having heart attacks is oftentimes very low. And part of the reason is that many women will say, oh, I'm probably fine, but I'm just calling just in case. It's probably just indigestion, but I'm calling. No, don't minimize your symptoms. Say, I'm concerned that I might be having a heart attack, okay? Ring the bell, ring the alarm. Make sure that your care is prioritized. Why am I sharing this information with you so emphatically, women? Because I've seen it over my years of practice. I can't even tell you how many times I've had women who have had heart attacks and they told me that they were experiencing some of these symptoms I just shared with you for weeks in advance, days in advance, hours, but they just kept doing other things. I didn't have time to go to the ER. I needed to take care of my kid. Didn't have time. I had to make sure my mama went to the doctor. I thought that maybe, I was just going through the change. It was perimenopause. I've seen women come up with many, many, many reasons other than the reason that it is, which is a heart attack. And unfortunately, some of them have some really negative outcomes. So, if you experience any of these silent warning signs of a heart attack, women, be it fatigue, shortness of breath, nausea, upper back pain, lightheadedness, jaw pain, cold, sudden sweats, make sure you call 911 and be sure to share this video with women you know. Share it with your mama, share it with your sister, share it with your auntie, share it with that girlfriend of yours who keeps saying, no, 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 I'm just stressed. I'm just stressed. Make sure you spread the word and be sure to give this video a like. If you have not done so already, be sure to subscribe to my channel. Here on the Dr. Frita YouTube channel, I give you evidence-based medical information in a way that is easy to understand. As always, I appreciate you for your support, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.